My name is Zintle Gantsho. I started realizing something was wrong when I started feeling very lethargic during some of my exercising. I'm an avid runner and cyclist, and especially during my runs, I noticed that I was starting to feel a bit fatigued. After one of my runs, I also was coughing uncontrollably for about 2 hours. In another run, I started feeling very faint to the point that I had to walk home, which is very unusual for me. But I kind of just wrote it off, just thought that maybe my body needs to get back into fitness, so I didn't really think much of it. But then I remember the one weekend after a very long ride, the rest of the weekend I just wanted to sleep. That's all I could think about, was just sleeping for like 2 days. And then at that point I also started feeling pain in my chest, some very sharp pains that would come and go. Again, I just kind of wrote it off and thought maybe with just some rest and some painkillers, I'll snap back to normal in no time. I remember on a Monday night, I started struggling to breathe. It was very painful every time I would try and inhale, to the point that I just couldn't inhale anymore. And that's the point at which I was taken to hospital, to the emergency room. So at the hospital, they ran a couple of tests, which included also an MRI. So it was at that point, after they took the MRI, that they noticed that there were blood clots in my lungs. So at the ICU, that's when they ran some tests to try and see what was the cause. They also just asked me some questions to see what risk factors they could be. And it was at the point when I was answering their questions that they noticed that there was a risk factor, which was the pill. So they explained that one of the severe and rare side effects of the contraceptive pills is blood clots, known as pulmonary embolisms. So I was in ICU for a total of 3 nights. I was in excruciating pain despite the painkillers that they were injecting into my drip. My actual biggest fear, besides the fact that I was in ICU, and whenever you're in ICU, there's a risk of something going wrong. So that was definitely a fear, but my other fear was the risk of getting COVID while I'm in hospital. I can't take any risks in terms of falling or getting injured or cutting myself, because now I have to be on blood thinners for a total of 6 months. So until December, I have to be on medication, which I have to take every day. So with that, I can't afford to fall, because the risk of internal bleeding is higher, and if I cut myself, the risk of bleeding excessively is also higher. So basically, being my extreme self and living life on the edge, I now have to live very cautiously and not take too much risk in terms of injuring myself over the next 6 months. So what I want to stress is for people to really do their research, which I did, but on top of that, be open-minded when you go into the doctor's office as to what other options there are in terms of contraception, and really take the time to consult with them, because at the end of the day, they know best. They are the health professional.
Hi, I'm Dr. Charlene Annell, and I'm just here to explain a little bit more about the relationship between the oral contraceptive pill and deep vein thrombosis, as well as pulmonary embolism. Essentially, the oral contraceptive pill works by suppressing ovulation. But once you take this pill, it also acts on your liver, and your liver is responsible for creating particles in our bloodstream that are called clotting factors. So clotting factors are basically proteins that are set up to help the body form a clot if we start to bleed. When you are on the oral contraceptive pill, you tend to make a slightly different group of clotting factors, so your levels of clotting factors slightly change just because your body metabolizes the oral contraceptive pill, and because of this shift, you might become a little bit more prone to form a clot. How common is this condition? So if we look at women that are using the oral contraceptive pill versus women who are not using the oral contraceptive pill, so let's start with women who are not using the oral contraceptive pill, their risk of developing a deep vein thrombosis in a year is 0.004%. So that is a chance of 4 per 100,000 woman years. So that's looking at 100,000 women in a full year, along the entire year, and only 4 of them would develop this condition. If we then take users of the oral contraceptive pill, this risk goes up from 4 in 100,000 woman years to between 8 and 10 per 100,000 woman years. So that would then increase your percentage chance in a year to 0.01%. So there is an increase, but it is still quite a rare complication. How we can compare this or look at other risk factors, let's say if you were not on contraception and you got pregnant, your risk of developing a deep vein thrombosis or pulmonary embolism when you're pregnant goes up to 30 per 100,000 woman years, so that would be 0.03%. And if you are postpartum, so this means you've delivered your baby, and in the first 6 weeks following the delivery of your baby, your risk goes up to 400 per 100,000. So much higher risks are associated with pregnancy. The other thing to consider is there are other risk factors that come along with this that would increase your risk. So same with this pool of normal women, women who smoke, women who have an increased body mass index, especially those whose body mass index is more than 35, so obese women, as well as women who are older than the age of 35 would have a slighter, higher risk for deep vein thrombosis. So if you add on the risk of being on the oral contraceptive pill on top of those risks, these women are at a super added risk. So before deciding on which contraceptive agent to think about for a woman really has to think about her individual life circumstances and her contraceptive needs. So when I say contraceptive needs, it's basically what do I want from this contraception? How long do I want it to last? What are my final family planning goals? Is my family complete? Do I not want children any further? Do I still want children? And if I do want children, do I want children in a relatively short space of time, maybe in a 2-3 month period? Or do I want children in 5 years' time? So how long do I want this contraception to last? The next question I need to ask myself is, what have I used before, and have I had any complications from any contraceptive agent before? Remember, it's not really a complication, it's more a side effect, and side effects are very person specific. After you've had a clot, you are not able to use the pill again. Why? The fact that you've had a clot before means you have an increased risk for developing a clot again. Remember, these clots can be life-threatening, so no. Once you've been diagnosed with a deep vein thrombosis or pulmonary embolism, we need to move you to another form of contraception.